Dear viewers, welcome to our learning community. We share medical education and MCQ practice to help you succeed in international exams. Each video is designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. Today, we will be discussing the neurological examination, an essential part of assessing the nervous system and understanding a patient's neurological health. The neurological assessment includes several key components: evaluating the level of consciousness and cognition, examining the cranial nerves, assessing motor function, checking sensory function, and testing reflexes. Each of these areas provides vital information about the health and function of the nervous system. First, assess mental status. Observe appearance, grooming, and body language. Check orientation by asking about time, place, and person. Test memory. Immediate memory with numbers, recent memory with recent events, and remote memory with past experiences like birthdays. Next, assess intellectual function. Test digit span, simple calculations, abstract thinking with a proverb, object similarities, and practical judgment questions. Now, assess thought content. Check if thoughts are spontaneous, clear, and relevant. Look for fixed ideas, illusions, or unusual thoughts like hallucinations, paranoia, or preoccupation with death. Next, assess emotional status. Observe the patient affect, whether it's natural, irritable, anxious, flat, or euphoric. Check mood stability, and see if their emotions match their words and thoughts. Compare verbal communication with nonverbal cues. Now, assess language ability. Check if the patient understands and responds appropriately, can read and explain a sentence, and can write simple words or figures. Difficulty in language function may indicate aphasia. Next, evaluate the impact on lifestyle by looking at the patient's role in family, work, and community. Then, assess the level of consciousness. Observe wakefulness, alertness, and ability to respond. The level of consciousness is the most sensitive indicator of neurological function and can be measured using the Glasgow Coma Scale. For the neurological examination, you will need some basic equipment: a tongue depressor, flashlight, sugar and salt samples, a watch, cotton-tipped swab, Snellen chart, ophthalmoscope, familiar odors, and a tuning fork. Start with the olfactory nerve, CNI. Test the sense of smell using non-irritating substances like coffee or tobacco. Have the patient close their eyes, occlude one nostril, and identify the odor. Repeat with both nostrils using different scents. Next, assess the optic nerve, CN2. Check visual acuity and visual fields, testing each eye separately while covering the other. Use a Snellen chart 20 feet and record the lowest line read with at least 50% accuracy. Now, assess the oculomotor nerve, CN3. Test eye movement toward the nose and observe for conjugate movements. Check pupil size and reaction to light, and assess the ability to open the eyelids. Next, assess the trochlear nerve, CN4. Test upward eye movement and observe for conjugate movements or nystagmus. Now, assess the trigeminal nerve, CNV. With the patient's eyes closed, test sensation on the forehead, cheeks, and jaw using cotton, sharp, or temperature stimuli. Check the corneal reflex with a cotton wisp. Assess motor function by having the patient clench their jaw while palpating the masseter and temporalis muscles. Next, assess the abducens nerve, CN6. Test lateral eye movement, usually along with the oculomotor and trochlear nerves during extraocular movement testing. Now, assess the facial nerve, CN7. For sensory function, test taste on the anterior two-thirds of the tongue using sugar or salt. For motor function, observe facial movements. Ask the patient to raise eyebrows, close eyelids, puff cheeks, smile, and frown. Look for weakness, asymmetry, or paralysis. Next, assess the acoustic nerve, CN8. The cochlear division evaluates hearing using Weber and Rinne tests, while the vestibular division checks balance and coordination. Next, assess the glossopharyngeal nerve, CN9. Check swallowing and test taste on the posterior one-third of the tongue using sugar or salt. Next, assess the vagus nerve, CNX, along with CN9. Observe swallowing. Check for difficulty. Test the gag reflex with a tongue depressor and ask the patient to say, to watch the uvula rise. Next, assess the spinal accessory nerve, CN11. Test the trapezius by having the patient shrug their shoulders against resistance, and test the sternocleidomastoid by turning the head against resistance. Next, we assess sensation. The main types to test are touch, pain, temperature, position sense or proprioception, and vibration. First, test tactile sensation using a cotton wisp or fingertip on both sides of the body, comparing proximal and distal sensitivity. Next, assess pain and temperature by distinguishing sharp from dull with a wooden stick and testing hot and cold objects for temperature sensation. Next, assess vibration and proprioception. Place a tuning fork on bony prominences like the toe or thumb joint and have the patient indicate when the vibration stops, comparing both sides. For position sense, with eyes closed, ask the patient to identify the direction of movement of the toe or finger. Now, assess motor ability. Inspect muscle size, tone, and symmetry, and observe gait and posture. Note any atrophy, tremors, or tics. Assess tone with passive movements, looking for abnormalities like spasticity, rigidity, or flexidity. Next, assess muscle strength by testing flexion and extension against resistance. Compare the right and left sides and check for subtle weakness using the pronator drift test. Muscle strength is graded on a scale from 0 to 5. 5 is normal strength, 4 is slight weakness, 3 moderate weakness, 2 severe weakness, 1 minimal contraction, and 0 means no movement. Next, assess coordination. Test rapid alternating hand movements. Perform the finger-to-nose test and a heel-to-shin test for the lower extremities. Observe for tremors, ataxia, or incoordination. Next, assess balance with the Romberg test. Have the patient stand with heels together and eyes closed. Loss of balance indicates a positive Romberg. For gait, observe the patient walking across the room and back, noting difficulty standing, walking, or rising from a chair. Test heel walking to check for dorsiflexion weakness. Next, assess deep tendon reflexes, including the biceps, triceps, brachioradialis, patellar, and Achilles reflexes. Here's how to test deep tendon reflexes. Strike the biceps tendon at the elbow for elbow flexion, the triceps tendon for elbow extension, the brachioradialis tendon above the wrist for elbow flexion with forearm supination, the patellar tendon for knee extension, and the Achilles tendon for plantar flexion. Test the Babinski reflex by stroking the sole from heel to ball. Normal, toes curl down. Abnormal, big toe goes up with other toes fanning. Seen in upper motor neuron lesions. Normal in infants up to 12-18 months. Next, assess superficial reflexes. The corneal reflex causes blinking, the gag reflex shows equal uvula elevation, and the plantar reflex produces toe flexion. Brain imaging includes CT scan for bones and bleeding, MRI for detailed soft tissue images, and SPECT to show brain activity and blood flow issues. That brings us to the end of today's lecture on the neurological examination. Thank you for watching. If you found this lecture helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future lessons. Keep learning, stay curious, and see you in the next session.